Okay, this comment. G'day, Zoe. I'm not singling the person who posted this comment out specifically because there were a lot of comments on the original post. Words to this effect, not to mention high temps cause seizures. Okay, they don't. High temperatures don't cause seizures. Even the seizures that we call febrile convulsions are not caused by high temperatures. So let me explain. A febrile convulsion is caused by a rapid acceleration of the temperature. So your temperature could go from 37 to 38.5 quickly, or from 38 to 39 quickly, or from 38.5 to 39.5 quickly. The point is, it's a rapid rise, not the number on the thermometer. A child with a temperature of 40 is no more likely to fit than a child with a temperature of 38.5. Just because of the number on the thermometer, that's not an indicator of whether the child is more likely to have seizure. So let's have a talk about what a febrile convulsion actually is in terms of what criteria do we have to have before it's called a febrile convulsion. To start with, the child has to have a febrile illness, an illness that causes fever. So that's a given. Then there are three criteria for febrile convulsion. The first criteria for febrile convulsion is that it's short-lived. It will only last 5 minutes or less, seconds usually, but up to 5 minutes. If it lasts longer than 5 minutes, it's not a febrile convulsion, it's something more neurologically sinister and should be investigated. The second criteria, it'll only happen once. That child who has a febrile convulsion will have a febrile convulsion only once during this episode of illness. So, notwithstanding, they could have another chest infection or another ear infection, months down the track, next year even, and have a febrile convulsion from that. But for this particular issue, for this particular disease, for this particular infection that they're fighting that's caused them to become febrile, only ever one febrile convulsion. So the child that's had a febrile convulsion at home is brought into our care at a hospital, and then we worry about whether they're going to have another fit. We've got to cool them down really quickly because that kid might fit again. That's not going to happen. A febrile convulsion only happens once. If they've had their convulsion, they've had their convulsion. They're not having another one. Not during this illness. That's the second criteria. So let's just recap. Short-lived, usually no more than 5 minutes, and only happens once in this episode of illness. The last criteria, and perhaps the most important criteria for diagnosing a febrile convulsion, and that is a febrile convulsion only happens in the first 24 hours of when you first spike the temperature. So the parent of a kid is not going to bring that child into hospital after 3 or 4 days of having a fever and then the child has a fit. That fit will happen within the first 24 hours, and it's often during the first spike. The first spike is by far the most common. If that child has had that fever for more than 24 hours, they are in the safe zone. A febrile convulsion is not going to happen. And if it does, again, it's not a febrile convulsion. It's a sinister neurological event, and it should be investigated. It should be considered to be harmful, perhaps, and it should be investigated. But they are the three criteria. Short-lived, only ever once in this episode of illness, and it happens in the first 24 hours. Now, on febrile convulsion, there has not ever been a study anywhere published to suggest that paracetamol or ibuprofen prevent them. They are not prophylactic medications. They will not prevent a febrile convulsion. So a parent who's had maybe a few children, and in the past some of their kids have had febrile convulsions, and now they're worried about baby with a fever might have a febrile convulsion, thinking that they should be giving paracetamol to their child to protect the child from having another febrile convulsion, that is false thinking. And medication should not be used for this reason. It doesn't prevent febrile convulsions. In fact, on the contrary, there is some weak circumstantial evidence to suggest that giving paracetamol or ibuprofen may actually exacerbate febrile convulsion. That child's put to bed miserable at 10 o'clock at night with a good hefty dose of paracetamol or ibuprofen. Baby goes off to sleep nice and settled, temperature drops as you would expect. Baby goes off to sleep nice and settled, is sound asleep in bed, so is mum and dad, sitting there in bed, sound asleep. 2, 3, 4 o'clock in the morning, so 4 to 6 hours after that last dose of paracetamol was given, that paracetamol wears off. Mum and dad are sound asleep. Paracetamol wears off, temperature starts to spike, and it's that rapid rise that triggers the fit. Suddenly there is the rattling of the rails of the cot in the nursery. Parents will rush down to the room to find that the child is either having or has had just had a febrile convulsion. My advice to parents, if they're going to be giving these medications, is that they need to commit to the full 24 hours. If you're going to be giving, it's like riding the tiger, you can never dismount. If you're going to give paracetamol to try and prevent fits, we know they don't, but let's say that you still believe they do, and you want to give that paracetamol to that child in that first 24 hours of illness, then you need to commit to giving it regularly, every 6 hours, without fail. Set your alarm and give that medication, because it's when it wears off, that's the danger period, where that temperature can spike. Please don't routinely give paracetamol just for a number on a thermometer. Please don't give it to try and prevent febrile convulsions. And remember that paracetamol doesn't prevent them. And remember that it's not the number on the thermometer that predisposes the child to a seizure. It's the rapid rise. I cover all of this in my paediatric emergency course. It's available online. And if you're interested, then just jump on to our link that I've got in my bio, and I'd be very, very happy to make that paediatric emergency program half price until the end of March.